Hi darlings, welcome back to my channel and welcome back to another video, guys. Today's video is about episiotomy, and when I talk about episiotomy is a surgical incision of the perineum and the posterior vaginal wall, generally done by a midwife or an obstetrician. Okay, so episiotomy is usually performed during the second stage of labor to quickly enlarge the opening for the baby to pass through. Okay, so when you are giving birth and then the baby is in distress, like the baby is delaying in there, most of the time the midwife will support the baby by giving you a cut or an incision. That is what we call an episiotomy. So in today's video we want to see how to care about this episiotomy. When you go through it, what you are to know and what you are to do. Okay, so sit back, relax and enjoy today's video. If today is your first time seeing me, I'm Owusua, your community health nurse, and this channel is about health education for kids and adults. Kindly do subscribe and be part of this beautiful and amazing family. In my previous video I talked about how to dress up a baby depending on the weather conditions, so we'll leave the link down below at the description box so you can go check it out. Okay, so let's go straight into today's video. So as I said earlier on, we are talking about episiotomy today, and I've already defined this episiotomy. So let's move on to the types of episiotomy. So we have the 4 types of it. We have the mediolateral, we have the median, we have the lateral, and then we have the G-shape. I don't want to go much into details about it, but these are the types that we have, like the types that they use to cut. Yes, they used to make the incision, the cuts of the vagina for the baby to pass through. Okay, so guys, let's see the indications for which this episiotomy is done. The indications for episiotomy to done. So 1 is facilitates vacuum or forceps assisted birth. Okay, and then also premature baby, and then when baby is in fetal distress, and it also facilitates the birth of a large baby. If the baby is big and the baby is in distress, we do this episiotomy for the baby to come out early to prevent other things. Okay, if the baby keeps long in there, when the baby comes out, the baby will be very weak, and baby will be needed much attention to resuscitate and other things. So we do this to help babies come out fast and then to prevent other complications. Okay, so let's see some possible complications of this episiotomy, and this may include 1, bleeding, swelling, infection, pain during sex, nerve ending around the perineum, and then collection of blood in the perineal tissue. Okay, so let's see how to care for this episiotomy. Okay, so after delivery, care of this episiotomy after delivery. The incision side needs to be kept clean, dry, to avoid infection. Okay, and then also you do not need to sit on hot water, and I repeat, when you have this episiotomy you don't have to sit on water. So before I move on with how to care for this episiotomy, once this episiotomy is done, that is the incision, once you are done, baby has come out, we don't leave it like that. Our dear midwives or doctors do suture it, so you won't leave it there like that. You suture it for you, okay, so that the place will be like the normal. Sometimes it becomes tighter than it used to be. Okay, so we don't leave it there. And once it is done, once the suturing is done, you don't have to sit on hot water for anything, because now what we use for suturing, when you sit on hot water it will melt. So my dear ladies, if you are watching me, kindly share this video and then it will be useful for somebody. Okay, so you don't have to sit on hot water, if not it will melt and then it won't heal properly to prevent infection. Okay, so you have to wash it slowly when you are bathing. Then you do sweet bath with salt, the big one. So you put it in water, then you use it to wash there, but not hot water, or I said warm water, please. All right, and then when you are caring for it too, your nails should be short to prevent infection, okay? And then when the nails are long and maybe dirt and others have entered your nails and you use it to wash the side, infection is possible. So you always keep your finger nails very short, okay? So you can use spirit and cotton to dab the incision side, okay? To spirit kakra or cotton kakra, now they are bobby ya palm on so kakra pepper so. Okay, so you have to also change your pads frequently. Then you sit and on your legs closed and sit upright. Seriously, episiotomy is very, 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 very painful. So you see some of the mothers sitting with their bottles hanging and stuff, but you have to sit upright. I know it's very painful, but if you don't sit on, the wound won't heal fast. So try and then sit on it, okay? So anytime you sit upright on the bottles, don't sit hanging your bottles. It's very painful, but what can you do? You have to also help yourself out so the wound will heal fast. And then you do not add any foreign materials or anything. No, don't add anything to it, okay? No, our mothers, our midwives at home, our grandmothers will be giving us concoction to put there, to do this, to do that. No, you can get it worsened or infected. So if you have any problem or you think something is not going right, just report and then you'll be taken care of. Kindly report to, not reporting to your mother at home or your doctor in the house. Report to the hospital or the facility that they did for you, or any hospital or facility nearby you, and then they will take care of you, okay? Also use ice pack to reduce the swelling. If you see any swelling, you can use ice pack. Maybe you can wrap it in a towel or a towel, and then you use to put it on to reduce the swelling, okay? And if the pain is unbearable, kindly report so you will be checked. I said it earlier on. If the pain is so unbearable, then you can report it and then they check it for you, okay? So you will be given a local anesthesia before the suturing. So when the suturing is going to be done, we don't do it like without giving you anything. Local anesthesia is being given before the suturing, okay, to make the incision sides becomes numb, so you don't feel that much pain over there. You'll be feeling that something is going on, but you won't feel that much pain in there, okay? So with this episiotomy, with this suturing is also done when baby is coming and then you have a tear. That one too, if the tear is severe, they will suture it for you. And when it is sutured, you follow this care that's I've mentioned it out for this episiotomy. Is the same care that you need to give to the suturing too, because one, they have sutured it with the same needle and then the thread that we use for the suturing. So you have to go by it, keeping the place clean to prevent infection and all that. So guys, this is all for today about episiotomy for our dear women that go in for childbirth, okay? It's not easy. So if somebody goes to labor and come back successful, you have to be very happy for the person, and then you have to congratulate that person, because the pains that women go through at the labor warding, it's not an easy thing. So guys, this is all for today. So you can share with me your experience if you've gone through this episiotomy, what was given to you, how you care for it, and all that down below at the comment section. So in my next video, we'll talk about breastfeeding for our babies and everything that you want to know when it comes to breastfeeding, okay? So thank you all for watching till this time. I say God richly bless you, and see you again in my next video, and it's bye.